Namaste Javins. Myself Javin Dr. Barkha Khurana. Today in human physiology we will be talking about shock. You all must have heard about shock. It is a physiological state that is characterized by systemic reduction in tissue perfusion and that results in the decreased supply of oxygen to the tissues. Other ways of shock could be when there is failure of the circulation to meet the metabolic needs of the tissues, and at the same time the tissues are unable to remove the metabolic waste products. When there is inadequate tissue perfusion to meet tissue demands, and there is inadequate peripheral perfusion leading to failure of tissue oxygenation that leads to anaerobic metabolism. See, whenever there is a disbalance between O2 consumption and oxygen delivery, that also leads to shock. Now we'll talk about the pathophysiology of the shock. Whenever there is inadequate perfusion, that leads to cell hypoxia, which in turn causes energy deficit, and there is accumulation of the lactic acid leading to fall in pH. That is anaerobic metabolism. And this fall in pH leads to metabolic acidosis, which further leads to vasoconstriction, failure of precapillary sphincters, and peripheral pooling of the blood. Then metabolic acidosis can also lead to cell membrane dysfunction and failure of sodium pump, leading to intracellular lysosome release, digestive enzymes that causes efflux of potassium and influx of sodium and water. And thus there are entry of the toxic substances into the circulation, leading to destruction and dysfunction of the cell. The cells switch from aerobic to anaerobic metabolism, and there is lactic acid production, and cell function stops and swelling increases, leading to mitochondria damage. The shock effects on the organs. Now we will talk about the effects of shock on the organs. If we talk about heart, there is decreased CO, hypotension, myocardial depressants. In lungs, there is decreased gaseous exchange leading to tachypnea and pulmonary edema. In endocrine, ADH leads to increased reabsorption of water. In CNS, there is decreased perfusion leading to drowsiness. And blood, there are coagulation abnormalities, and so on. Now we'll talk about the types of shock. First is hypovolemic, because of hemorrhage or blood loss, plasma body water loss, electrolyte imbalances like vomiting, diarrhea, dehydration. Then next is the cardiogenic shock. The etiology are valvular heart disease, myocardial infarction, cardiac arrhythmias, and cardiomyopathy. Then obstructive shock is there. Causes are cardiac tamponade, pulmonary embolism, tension pneumothorax, and air embolism. Next is the neurogenic shock. Causes are paraplegia, quadriplegia, trauma to spinal cord, and spinal anesthesia. Next is anaphylactic shock, caused by injections of penicillin, anesthetics, stings, and shellfish. Septic is there, caused by gram-positive, gram-negative bacteria, fungi, virus, and protozoa. Then is endocrine, cause of which could be hypo and hypothyroidism, adrenal insufficiency. Now we'll talk about the clinical features. It is divided into three types: mild, moderate, and severe shock. In mild shock, there is collapse of subcutaneous veins of extremities, especially the feet, which become pale. There is sweat on forehead, hand, and feet. Urine output is normal, pulse rate is normal, and BP is also normal. In moderate shock, mild shock features are present like drowsiness and confused. Oliguria is there, pulse rate is increased, usually less than 100 minutes per minute. In severe shock, the patient is unconscious, there is gasping respiration, anuria, rapid pulse, and profound palpitation. So this is all in this session. In next session, we will be talking about the management and stages. I hope you understood this session well, and if you have any doubts, you can post a comment. This session is powered by Digital 2.0 version of Jayoti Vidyapeeth Women University. Thank you.